All right, it's time now to talk about one of our favorite things, our furry friends, when it comes to pet patients. Vet visits can be, they can be difficult because our animals, they can't communicate clearly with us.
I mean, they do communicate, but maybe they don't talk to us just the way we want.
Yeah.
But we have the animal whisperer and also one of our favorite people, Dr. Andrea Dennis from the Bloomfield Animal Hospital. What are they saying?
Ouch, is what they're saying on our topic today.
Arthritis, is it common in pets?
It's very common, especially as they get older.
Yeah.
So we're talking about, maybe 60% of the population.
Really? More than half?
More than half. And cats are incredibly,
cats.
a lot. And we see a lot of arthritis in cats, but they hide it so well.
They really
And that's
do.
what we're going to talk about, some of the signs. How do you know they're starting with some arthritis? Because you want to try to intervene as soon as possible, because we cannot cure arthritis. We can just kind of slow down the process.
Slow the progression. Okay.
So let's talk about that. Like, what are some of the signs, and is there an average age for a cat?
No, I would say, at middle age, we start seeing anything at 7, 8, 9.
Okay.
But the older they get, the more common it is. It's called primary arthritis. But my dog had ended up having arthritis very early because of trauma. So if they tear their ACL, if they have a fracture of some kind, especially near the joint, they're going to have arthritis earlier.
Sure.
And I thought I did bring a model to kind of show what it looks like.
Make no bones about it.
Okay. So I thought, let's start with the normal hip here.
Okay.
And the reason I chose this joint is because it's such an easy one to picture. It's a ball that fits in the socket, okay? And it's supposed to move. Very easy. You're not supposed to hear anything when it's moving. That's a normal joint. If we go to a severely arthritic, you can see the difference.
Yeah.
That bone on bone, the cartilage is gone, and it's just crunch, crunch, crunch. Now, a lot of dogs that have this, I can feel it. In cats, I feel it more in their elbow. But as I'm manipulating them, I can feel that crunching. It's called crepitation. So that's to picture how severe that is. That's important. I just want to have that visual in your mind and why we need to be a bit aggressive treating it.
Okay.
Now, I had it, personally, my hip looked like that before my hip replacement.
Your own hip.
Your own hip. Not a dog hip, your hip.
Mine. And I think I'm a little bit more empathetic. Sorry, I touched my mic. I'm a little bit more empathetic because I know how much pain I was in. Okay. And that's what we want to try to do.
So it starts, though, with weight control?
Absolutely. Same thing with humans. It's not easy, but it's cheap, but it's very effective. If we can keep our weight under control and keep our pets' weight under control, it's really going to minimize how painful they are and how much stress is on those joints. So if we can start when they're 1, 2 years old, let's do that.
You say slow the progress. How would you do that? Medications?
Well, yes. Now, one of the first things we do is something called supplements. So your glucosamine, have you heard of that?
Yeah,
yeah, chondroitin sulfate. Those are supplements. They're not drugs. Okay. And what they do, they help nourish the joint. They make sure that the cartilage stays as healthy for as long as possible. So
humans do that too.
They do. But a lot of times we wait until we're really feeling the discomfort before we start them. Again, going back to my dog as an example, as soon as he tore his ACL and I had it surgically repaired, I started him on the supplements at 2.
Okay.
And I think, if you can afford it, I don't think any age is too young to start the supplements once their bones are fully developed.
Right.
But talk to your veterinarian about that.
Okay.
But those, you can even get those online.
Okay.
So that's the early stage. And the next thing is once the arthritis forms, we want to use NSAIDs. Cats can't handle a lot of NSAIDs. They tend to get very upset stomach. It affects their kidneys and liver. So we have very few minimal choices for cats with NSAIDs. Dogs, we have many. And those are non-steroidal anti-inflammatories.
Like Advil for humans.
Yes, which is dangerous and can kill a cat.
So don't even, but they have something like that, like kitty Advil?
We do, but we can only give it once in a while. But with dogs, we can do it every day. So again, it's a conversation with your veterinarian, but we can help that.
That's really remarkable.
Yeah.
What about, so you said there's also something called anti-nerve growth factor.
That's the new one. Again, it's phenomenal, and I'm so excited about it. Actually, for cats, we've had it for about a year. And anti-nerve growth hormone is developed when you have inflammation. So that joint that I was showing you gets a lot of inflammatory mediators, and growth. That's why we want to try to bind that nerve growth mediator, and it's been wonderful. I have seen huge differences within one injection.
That's terrific.
Yeah, so cats, you get, it's a once a month injection.
Okay.
It's called Silencia. You do it, and you have to go to the veterinary office, but it's mind-blowing, the difference in them. And then dogs, it's called Librela.
All right, we got to leave it there, but I'm glad you talked about your personal hip injury, because typically that violates a HIPAA.
Okay.
So it was nice of you to share that with us.
You're so used to him.
Thank you.
Yeah, I guess it's like right over the head. All right, you can find Bloomfield Animal Hospital at 77 Old Windsor Road in Bloomfield. That's where you'll find Dr. Dennis. And to get in touch with her, you can also visit BloomfieldAnimalHospitalCT.com. Call the number 860-286-2986.
Thanks, Doc.
Oh, my
Doc.
pleasure.
Always a pleasure.